Audio recording for this meeting has begun.
All right, thanks everyone. This is Leanne Bryan from the National Center on Subsidy Innovation and Accountability, welcoming you all to our fourth webinar in this fiscal year series. Today's webinar is all about tips and tools for managing the CCDF program and CARES Act funds.
Who's my good girl? Who's my good girl?
We have some folks that are not muted. So just quick note to all of our participants, you should be muted on our end, but just in case, if you could please mute your line, that will avoid that background noise for everybody. Okay, just a little bit of housekeeping before we jump in today. We are using an Adobe Connect platform for today's webinar. We've used this a few times now, so for those who are newer, we hope you enjoy the experience. For those that have been with us for a while, this shouldn't look new to you. Due to the large number of registrants that we had for today, we did have over 400. And for the participants that we have on the call today, we are not planning to turn on audio, but we do encourage everybody to use the chat pods and ask questions of our presenters and of each other. If someone has a question that you want to ask to your peers, please go ahead and use that chat box. We will pause throughout the webinar for discussion, and we will do our best to address all questions that come in. But if there is anything that we're not able to get to, just know that we will follow up individually after the webinar. If you happen to have any issues today, technology-wise, please reach out to Heidi Freimiller. Her email address is shown there. Okay, some quick introductions. Here's our team of program integrity and fiscal accountability experts at the National Center on Subsidy Innovation and Accountability. That is me on the left, Leanne Bryan. Oh, and I see your note, Lily. Speak a little louder. Oh my, okay. So you guys are having a hard time hearing me. Sorry about that. If anyone else is having audio issues, let me know, or feel free to type in there. We want to get started out on the right foot here. Okay, back to the slides. That's me, Leanne Bryan, Program Integrity Manager here at Cynthia. And as I move across the slide, I have Ann Avila, Fiscal Management Subject Matter Expert. And we have two Program Integrity Specialists, Janae Broadway and
Your microphone has been turned on.
We have Linda Winings and Adi Fator from the Office of Child Care's Division of Oversight and Accountability. Linda?
Yes, thank you. Good morning and good afternoon, everybody. It's my pleasure and privilege to welcome you to the fiscal year 2020 National Program Integrity Webinar Series. As Leanne said, this is webinar number 4. Entitled Tips and Tools for Managing CCDF Program and CARES Act Funds. And my name is Linda Winings. I work in the Oversight and Accountability Division of the Office of Child Care with my colleague that you see up here on the screen, Adi Fator. So Adi and I spend a lot of our time focused on all. So as a result, we're aware of many of the challenges that states and territories have faced this year, from lack of access to case files to being diverted to more urgent tasks, very policy and technical ad hoc changes. So we're also aware that there have been questions regarding how to use the Act funds and how best to budget in this new normal. So OCC is, honestly, we're in awe of your work and your ingenuity and your dedication to the people that we serve. So we are here to support you, and we're so glad that you are able to be here as the National Center on Subsidy Innovation and Accountability, and they're amazingly knowledgeable, kind, hardworking, helpful subject matter experts will walk you through the topic of the day. And the last say we're very excited that Michigan is going to be sharing their experiences with us. Thank them very much for their willingness and generosity. And now I will just turn this over to our fiscal subject matter expert, Ann Avila of NICSIA. Thanks so much.
Great. Thank you, Adi, and welcome everyone. Thank you for joining us today. We're really excited to talk to you about CCDF and CARES Act funds and to provide tips on how to support the child care industry. To start, we're going to do just a brief overview of CCDF funds. This should be a refresher for most people. We'll also do an overview of the CARES Act funds and how those funds can be spent. And then we're going to go into a deeper dive on tips for supporting child care with CCDF and CARES Act funds. And then in the Program Integrity Document Pod in Adobe, we do have a memo that was recently released that we want you to take a look at, and that covers tracking CARES Act funds, which is the next thing that we'll talk about. So the brief is called Understanding the CARES Act Memo, and it covers tracking funds, maximizing your federal funding, and other recommendations for managing your CARES Act funds. So we'll talk about that. And then we will move on to what a lead agency should consider with a limited CCDF budget. This section may be particularly relevant now for some lead agencies given the impact of COVID-19 on the child care industry, so we'll talk a bit about that. And it leads into a tool that we've developed at NICSIA, which is a budget calculator, and Michigan has been kind enough to pilot it for us, and we'll talk about their experience today as well. So once that's done, we will move on to questions and next steps, and we have a lot of time at the end for discussion about what we presented today. So with that, I will turn it over to Mike McKenzie to give a brief overview of CCDF.
Thank you, Ann, and good afternoon, everyone. I'm checking in from Madison, Wisconsin today. It's almost a fall day here, high of 70 degrees, so beautiful day here. I want to take the next few minutes to provide you with a high-level overview of CCDF funding and kind of set the table for the rest of our discussion today. This information, or most of this information, is also available in a fiscal fundamentals brief that is included with the program integrity resources that we've provided you with today in the box, just to the right of the chat box there. These are the current categories in rule related to what activities CCDF funds can be used for. So I'm just going to summarize these briefly. At least 70% of mandatory and matching funds must be spent on families who are receiving TANF, making efforts to work activities to transition off TANF, or at risk of becoming dependent on TANF. Of aggregate funds expended by a state or territory, and here we're talking about mandatory, matching, and discretionary funds, 12% needs to be directed toward quality child care activities, like training or developing a quality rating system. 3% of these funds need to be focused on quality activities for infants and toddlers, like specific training or intervention activities for this population. Keep in mind that these are minimum levels, and lead agencies may reserve more dollars for quality activities if you deem it appropriate. Now, lead agencies may spend up to 5% of the expended aggregate funds from each year's allotment on administrative costs, including salaries and benefits, indirect costs like rent and overhead, other costs incurred such as rental equipment, utilities, and office supplies. From the remainder of the discretionary funds, after spending on quality and administration, state and territories must spend at least 70% to fund direct child services, like payments to providers or families. You can also spend your allocation on creating child care resource and referral networks, but this is completely optional. I also want to note that tribes have additional flexibility when it comes to allowable uses, with a 15% administrative cap and an 8% quality spending requirement. Additionally, tribes do not have the requirement to spend 70% on TANF-eligible families, And there is no match requirement for tribal lead agencies. Now let's quickly walk through the 3 federal funding streams for CCDF. The blue column on the left describes the stats or info we elected to highlight for each of the funding streams. I'm going to focus on what agencies the funds are available to and how they are allocated. Mandatory funds are 100% federal, and they're available to all 50 states, DC, and the tribes. Funds are allocated to states based on the now repealed AFDC-linked child care program from the 1990s. And for tribal agencies, a formula is used based primarily on the number of children within the tribe. Matching funds are available to the 50 states and DC only. Allocation amounts are based on the number of children under age 13 living in your state compared to the national total of children under age 13. Discretionary funds are also 100% federal and are available to states, territories, and tribes. Allocations are based on a formula that includes 3 factors. Those are the state share of children receiving free or reduced price meals, the number of children in the state under age 5, and the state's per capita income averaged over 3 years. Now, one more note about discretionary funds. States can transfer up to 30% of their TANF grants to CCDF, and then these funds essentially are treated as discretionary funds for CCDF. Now here we've provided a chart that briefly explains when mandatory matching and discretionary funds must be obligated and liquidated for states, territories, and tribes. And you can see in this chart that there's a separate column for the tribal funding. But for the sake of time today, I just want to focus on the last column related to the timeframes for CARES Act funds. You can see that lead agencies can obligate these funds until September 30th of 2022, and that these funds have to be liquidated by no later than September 30th of 2023. Okay, folks, so that's just the brief overview of CCDF funding, just to kind of set the table. We've allocated a little bit of time now for any questions you may have for us or your peers related to CCDF funding requirements and allowable uses. So please go ahead and post your questions in the chat box now if you have any. We'll try to answer as many questions as we can today.
Tina, which
Looks like
chart
we have.
would you like?
Sorry, guys.
Is that the chart you want, Tina? I hope. And I should note that this whole PowerPoint is also available in the Program Integrity Resources links below. So there will be a PDF that's available that'll have all of this information in it, folks. So Ann, I'm going to pose a question from Verna here. It says, if states transfer some of their TANF funds to child care, can some of these funds be made available to non-TANF tribes? Do we know that answer?
I'd prefer to defer to the tribal center on that one, so we will follow up directly with Verna on that.
Okay. And we've got a lot of good questions here, folks, but very little time to get back to you on this today. So for those questions we don't get to, we will follow up as we obtain the answers for you, like Leanne mentioned at the start. A couple other questions I'm just going to pose to the panel quick. Are there any monitoring reporting requirements for the quality initiatives? That's from Christine. Anybody know the answer to that?
There are updates that are coming to the quality progress report, which we'll talk about later on here. There are not specific monitoring or reporting requirements right at the moment that have come out yet, but we will mention that later in the webinar today.
All right, I'm going to pose one more question and then we'll wrap this up for now. Dorothy writes, we have an approved indirect rate. Is indirect an allowable expense or cost?
So administration is an allowable expense or cost. If your approved indirect rate is under your administration, that is an allowable expense or cost, but the limits on administration still apply.
Okay, thanks, Ann. Hope that helps, Dorothy. For the rest of you, the questions that you posed today will not go away, and we'll follow up on these and obtain the answers and get back to you directly. I want to thank you all for participating in our webinar today. We really appreciate it. And with that, I'm going to hand the mic back over to Ann. Thank you.
Okay, thank you so much. So in this next section, we are going to give you an overview of the CARES Act funds. And this is a high-level overview. Some of you are probably already familiar with it because we know the states have been doing a lot of work, but we want to set this baseline before we go into a deeper dive. So in March of 2020, $3.5 billion was approved for lead agencies through the CARES Act for CCDF, and the funds can be used in a number of ways. They can be used to provide assistance to child care providers to help them stay open, which we know many states are doing, to provide funding for providers, including those that did not previously receive CCDF funds, to clean, sanitize, maintain, or resume operations. And they can be used to provide funds to pay the wages and salaries of child care staff. And there's a number of other allowable uses that we'll discuss in more detail in the next section. These are the categories that are currently in the CARES Act, but we have quite a bit more detail that we'll go into on that. So CARES Act funds can be used to pay for child care for essential workers. This includes those who were not previously recipients of CCDF funds. And these workers can also be exempted from typical CCDF income eligibility requirements. CARES Act funds can be used to restore funding that was spent prior to the passage of the CARES Act. So if a lead agency incurred obligations related to preventing, preparing for, or responding to the coronavirus prior to this act, then funding from the CARES Act can be used to restore these funds. I'll cover a few differences between CARES Act funding and CCDF. Essentially, the requirements that we just heard about from Mike earlier do not apply to CARES Act funds. So, for example,
your
there's
microphone has been turned
for
on.
Spending on families with low incomes or those who are TANF eligible. The typical requirement of spending 70% on direct services after quality and administrative spending does not apply to CARES Act funds. And then the requirement to set aside funds for quality improvement and infant and toddler quality activities does also not apply to CARES Act funds. And then finally, two providers can be paid for the same subsidy-eligible child for the same time of service. So, for example, if you have a child who needs to go to a different provider while their primary provider closes, then two different providers could be paid for the same child. So this is a really high-level overview. We're happy to field a few questions here on what we just covered, and then in the next section we're going to go into a deeper dive, and we do have a lot of time at the end for discussion. So are there any questions on the allowable uses of CARES Act funds that we just covered?
So.
Please type any questions into the chat pod. Thank you.
So are the CARES funds considered fiscal year 2020 funds? Carolyn, I might need some clarification on this. They are part of your fiscal year 2020 allocation. They're added to fiscal year 2020, and then the timelines that Mike covered earlier apply. If that doesn't answer your question, please let us know if you'd like further clarification. So is an essential employee described by each lead agency? There is flexibility around how to determine who is an essential employee. There's some examples in the CARES Act, such as healthcare workers, but there is flexibility there. Okay. And Carolyn, we'll send you some feedback directly on your question about backing it out of your quality percentages. Okay, and just one more minute if there's any other questions here. Okay, not seeing any at this time, so I will go ahead and I'll turn it over to Janae Broadway. And Janae is going to talk to us about tips for supporting childcare with CCDF and CARES Act funds.
Janae, I am not able to hear you. Janae, this is Leanne. I think you might be muted on your end. Janae is not muted. Heather, are you able to provide any support for Janae? Hang in there, folks. We're trying to get this all figured out. Yes, the webinar recording will be shared. Thank you for your patience, everybody. We're trying to get Janae's audio restored. We do have support from our Meeting One rep on the line.
All right, can you guys hear me now?
Yes.
Perfect. Okay, we're ready to go. So thank you guys for your patience. We sincerely apologize. As Ann stated, this section covers tips for supporting childcare with CCDF funds and CARES Act funds. Specifically in this section, we'll discuss tips on how lead agencies can maximize funding and expand childcare services to meet the needs of providers and families during the emergency. So beginning with additional funding streams. Coordinating your CARES Act and existing CCDF dollars with other federal funding streams and programs is a way to maximize available funding. Now on your screen, there are a few coordination examples. Beginning with the existing CCDF funds, if a lead agency is already receiving or will receive funding from a different source, the lead agency can maximize funding through a fiscal management process that reviews obligation and liquidation periods for spending. Now, as Mike stated earlier, there are different liquidation and obligation periods for CCDF and CARES Act funds.
Mike provided us with the current liquidation obligation periods for both. So what is important here is that those periods may differ from other federal programs. So when the lead agency has those different spending timelines, the lead agency may want to consider spending funds with the earliest deadline first. And next we have TANF, so Temporary Assistance for Needy Families. TANF funds can be spent on child care, and as Mike stated earlier on, up to 30% of TANF grant, up to 30% of TANF grant award can be transferred to the CCDF program. Now, if the TANF program is not administered by the lead agency may want to consider working with the state TANF agency to identify funding that can be used for the child care program. We also have here Small Business Administration, or SBA. So SBA provides several coronavirus relief options for small businesses. These options can be accessed by child care providers and can help maximize available coronavirus relief funds for lead agencies. Now, this can be done through educating providers who are not aware of the available sources for funding, and those are funding streams such as the Paycheck Protection Program, which provides funding for small businesses to keep their workers on the payroll, as mentioned earlier, or the Express Bridge Loans, or the relief program for providers who have a business relationship with SBA. Now, for those who are not already layering or coordinating, CCDF funds can be coordinated and layered with Head Start or Early Head Start funds to support low-income families. Now, the underlying criteria or factor here is that families must be eligible for both funding streams. The key here is for the lead agency to establish ways in which the lead agency can align their CCDF eligibility with the Head Start or Early Head Start program. And lastly, and certainly not least, we have the Workforce Program. So here we have the coordination with CCDF, TANF, and Workforce Services, and it can offer support for families with low incomes re-entering the workforce. Lead agencies could explore here ways of creating and strengthening relationships with those local state and local agencies to offer child care to families looking to return to work. Now, as I stated, these are just a few examples of ways lead agencies can maximize funding through additional streams and to meet the needs of families and providers in their community. See here. And Jennifer, you do have your question here, and we'll answer your question. We'll circle back to your question. Right. So let's move here. Let's look at some CCDF and CARES Act allowable activities the lead agencies can use to support child care. So before we get into these examples, as a reminder or disclaimer, some of these activities may require a CCDF state plan amendment or waiver, and the lead agency should consult their regional office specialist prior to making program changes. All right. So first, lead agencies can expand their definition of CCDF for children receiving or at risk of needing protective services to include children of healthcare workers, emergency responders, law enforcement, child care workers, food and agriculture workers, manufacturing workers, or other essential workers designated by the state. Next, with CARES Act funds, lead agencies can provide child care assistance to essential workers without regard of their CCDF income eligibility limits. For example, if your state eligibility income limit is 50% of the SMI state median income, with CARES Act funds, essential workers who are over the 50% SMI but under the 85% can be eligible for CCDF utilizing CARES Act funds. In addition, CCDF and CARES Act funds can both pay for direct services for applicants and or recipients who have not exceeded the federal maximum of 5% of the state state median income. Next, in this third column, lead agencies may consider waiving the CCDF income and or asset limits for families of children receiving or needing to receive protected services as identified by the lead agency in column 1, which may include healthcare workers or emergency workers. And in this very last column here, if applicable, a lead agency may consider changing policy that discontinues CCDF prior to redetermination due to a non-temporary loss of work or the end of job training, or educational activity, and continue services at the minimum of 12-month eligibility. Now, another allowable, we have some more allowable activities. Another allowable activity is to continue eligibility throughout the duration of the emergency. Understanding the final rule established a 12-month minimum eligibility period, which means eligibility could be extended. Next, a lead agency could consider waiving co-payments for families affected by the emergency under the criteria established by the lead agency. Also here we see that CARES Act, CCDF and CARES Act funding. With CCDF and CARES Act funding, the lead agency has the option to define working to include families seeking employment or participating in a community service or similar activity. Also, lead agencies can use their regular CCDF direct service funds and CARES Act funds to maintain child slots with child care providers who close or experience decrease in enrollment by expanding or delinking attendance policies during the emergency. Now, I know that this is a lot of information to digest, and some of your wheels may be turning for next steps. For your convenience, within the Understanding CARES Act brief that is available for download in the resources pod, Appendix A provides a comparison chart of the CCDF and CARES Act funding allowable charges. So now let's move to support and stabilization. And here we'll go over a few ways lead agencies can use their CCDF and CARES Act funds to support quality and stabilize supply of child care. Well, ask that you guys mute your phone, please. Thank you. So on the screen, we see that lead agencies can use the CCDF quality funds and or CARES Act funds to provide sustainability. Yes. Still got that feedback, folks. Okay, that's 1 second. I apologize. All right, so let's try it again. Hopefully we've gotten the feedback and echo under control. So on the screen, we see that the lead agencies can use the CCDF quality funds and CARES Act funds to provide sustainability grants to providers who were mandated or opted to close or needed to remain open. The grant recipients can include providers who did not previously receive CCDF assistance. Next, both funding sources, CCDF Quality and CARES Act, can be provided to those same providers, meaning including those who did not receive CCDF assistance prior to funding for purposes of cleaning, sanitation, obtaining PPE or protective equipment, personal protective equipment, and any other activities necessary for the providers to maintain or resume operations. Also, these funds can be used to support your child care resource and referral agency, organization, or other community agencies to disseminate information and assist providers in applying for state and federal assistance from grants or loan programs like with the SBA that we mentioned earlier. Now, without in addition, lead agencies can continue to make payments to providers who experience a decrease in enrollment or who close temporarily so that they can reopen as quickly as possible. And lastly, with these funding sources, lead agencies can supply building grants or contracts to providers for equipment, supplies, professional development, staffing, air quote, minor repair and remodeling, and other administrative costs. So as you can see here, there are many ways the lead agency can maximize funding and expand child care services to meet the needs of providers and families in their communities. We're going to move here. Considering the information and your state's current circumstances, let's conduct a short poll here. All right, so the poll reads, is the CARES Act funding sufficient to cover the needs of your lead agency and families and providers that you support? We'll give you guys about a minute or two. All right. All right, we still have individuals still casting their vote. And it looks like it's slowing down just a bit. All right, so we're going to close out the poll now, and yep. And it looks like it's pretty split between yes and no. There's a lot of unsure out there, and this would be a great time for you individuals to look at some of the ways that we provided, the strategies that we've provided, as it relates to maximizing those benefits and expanding care, in addition to talking to legislators and other stakeholders about your current funding. And let's talk about it just a little bit more here. I'm going to ask you guys a few questions here. Awesome. So on your screen, you'll see two chat boxes. Each box has its own individual question. I'd like to say that by responding to these questions, it gives your peers an opportunity to see what you're doing, and you also have an opportunity in return to see what your peers are doing with the CCDF, CARES Act, and other funding streams. So the first chat box asks the question, what other strategies is your lead agency using to support child care providers and families with CCDF and CARES Act funds? The second checkbox question asks, are there any funding streams that your lead agency is using to support child care that were not mentioned here? And we'll give you guys about 3 or 4 minutes to respond to those questions. And for those who are only able to join audio, I'll read out some of those responses for you. Okay, so Bonnie has a question for other individuals on the call. Has anyone used the CARES Act funding, CARES Act for staff, and if so, how? And she asked that question in the chat box 1. So if anyone has used any of their CARES Act for staffing, it would be great if you could share that with Bonnie. In our second chat box, Janelle stated that my lead agency is supporting by announcing all additional grants and SBA loans that are offered to the providers. So Janelle, can you tell us how you guys are announcing that information? Celeste indicated in the second chat box that they're waiving parent fees for parents receiving subsidy. and Sylvia. Okay, we're using CARES Act funding for our child care coordinator. And I see others are typing. We'll give it some more time. Bridget indicated we use CARES funds to offer additional daily add-on rate, for providers and emergency grants for providers. We waive co-pays for parents. Dorothy, we also waive co-pays. Additionally, we offer mini grants to providers for both quality improvement activities and additional costs related to COVID, cleaning supplies, etc. And Dusty indicated waiving co-pays, paying child care based on enrollment, not attendance until October 2020. All righty. So I'd like to thank you guys so much for sharing. I'm sure your peers really enjoyed getting that information or you guys providing that information to them. Thank you again for your time and participation. We'll now close those chat boxes and I will turn it over to Ann. Thank you.
Okay, great. Well, thank you so much, everyone. Thank you, Janae. And we really appreciate your patience as we're working through the audio on the call today. So in this next section, we'll talk about tracking recommendations and then also upcoming reporting requirements for CARES Act funds. I mentioned earlier that the Understanding the CARES Act memo in the Program Integrity Resources covers tracking funds. So this actually is within there if you'd like to look at it afterwards. So I just want to start by saying that these are recommendations only. We do realize that every lead agency's tracking system has different capabilities. These recommendations will hopefully help you figure out some best practices for tracking recommendations, but we do understand there's sometimes limitations. So the first recommendation that we make on tracking your CARES Act funds is gathering information on all of your available funding sources for coronavirus relief. And this is meant to help you determine all of your available funding to properly budget for and track dollars spent on coronavirus relief activities. The second recommendation is to set goals and objectives for CARES Act and other coronavirus relief funding. And this is meant to help you target your funds to your most critical needs and create a framework for measuring progress towards your goals for coronavirus relief activities. And when we say goals and objectives, it's not necessarily a big performance management system. This could be something as simple as setting goals on the number of providers or parents that you'd like to serve with your CARES Act dollars. The third recommendation is to prioritize and rank your most critical needs and allocate funds accordingly. This will help you target critical and often limited resources to their highest priorities and needs. The fourth is to track your budgeted funds compared to your actual spending and address any variance in your spending. And this will help you ensure that the CARES Act funds are being spent on intended purposes and highlight any instances in which funds are not being spent as planned. And then the last recommendation is to maintain your CARES Act funds in a separate account with appropriate accounting codes for specific uses. And this will help differentiate your CARES Act expenditures from your CCDF expenditures. Then on this slide, we're going to cover where we've seen some success with states with tracking their funds. Some states have created a centralized authority to approve CCDF CARES Act activities, such as a governor's office or a lead agency. We've seen states that have had waiting lists that they've created with a central authority to certify and prioritize services for essential workers. We've also seen states where they have a centralized approval for their grant programs so they can track how Grant Act funds are being spent. We have seen states set up systems with different accounting codes or ledgers, as we mentioned before. And then additionally, there's states that have set up attendance and provider systems with different codes for CARES Act funded payments. And these are all activities to help them track their CCDF and CARES Act funds separately. Now, I'll briefly touch on the reporting requirements. The ACF 801 is the only one that where it's officially been released so far, so I'll talk about that one first. And then for the remaining 3 reports, there is guidance coming out, but we do have some initial information on what will be requested from lead agencies. I do want to note that tribal centers will report their data separately, such as on the ACF 696T or any other reporting forms that you have for CARES Act funds. So to start, for the ACF 801, this is case level data on the recipients of CCDF. Right now, there is guidance on the OCC website, and basically, lead agencies are being requested to report on data on income for determining eligibility, monthly amounts paid to providers, and hours of care during the month related to the CARES Act. And I do encourage you to go to the OCC website as there's more extensive detail on the ACF 801. For the ACF 696, there is going to be guidance coming out on the financial data on CARES Act obligations and expenditures, and lead agencies will be required to include a narrative in their 4th quarter report on the use of CARES Act funds. For the ACF 218, the Quality Progress Report, we did get a question on quality earlier. Lead agencies will be required to report on how CARES Act funding has been used to support quality activities. So again, there will be further guidance on that. And then for the ACF 800, this is the lead agency's unduplicated annual counts of children and families served through CCDF. Lead agencies will be asked to report on data on annual estimates of families, children, and providers served or supported by CARES Act funds. So on this next section, we just wanted to see if there are any questions that you have on tracking of funds or reporting requirements. For reporting requirements, we do have people here from the central office that may be able to answer some questions. If not, we will definitely follow up with you on that. And then the second question is, what strategies has your lead agency used to successfully track CARES Act fund expenditures? You know, maybe there's something different than what we talked about today that your state is doing that has made you be successful. So we'll give you a few minutes for that. Okay, so we do have a question about distributing PPE. Are we still able to claim those dollars as quality, or is it only if the lead agency provides funds to providers for PPE procurement? That might be one. I'm curious if anyone else from our team has an answer to that, or if OCC has an answer to that, but that might be one we need to follow up on. And then to Catherine, your question about the guidance for the 696, 218, and 800 reports, I do know that the OMB has approved some new forms. For example, for the 696, I don't have a date yet on when those will be released. And Amanda, we will follow up to your question on the personal protection equipment specifically. Okay, and Lisa Brewer-Walraven said, in Michigan, we are being asked about award letters and guidance for our child care provider grants. As we are issuing these likely like subsidy payments to providers, where can we find an answer to this? I'm going to see if anybody on my team has an answer to that or if we should follow up. In the meantime, Sylvia has shared that for successful tracking strategies, she's using separate fund codes and CUF accounts for CARES Act monies. A couple states are saying they're doing that. Okay, and then Lisa, we will again follow up with you specifically on that one to get some clarification and get back to you about your question. Okay, so thank you all so much for your time on that piece of it, and like I said, we'll follow up with you directly on anything we didn't answer here. Okay, so for this next section, we are going to talk about what a lead agency should consider with a limited CCDF budget. So basically, we're going to talk about how changes to copay structures, reimbursement rates, and eligibility systems impact a state's overall budget and considerations you may need to make in other areas of your budget based on this. So eligibility levels refers to your income eligibility levels for families. Rates are the reimbursement rates that you pay providers, and then the copay is the family share of child care subsidy payments. And so we have two triangles here that illustrate how changes in one side of your budget can impact other aspects of your budget. For example, in the triangle on your left there, you can see that if you were interested in raising your eligibility levels or your entry and exit levels for your program, then that may, if you're looking to increase it, it may impact your rates and your copay. You may need to consider adjustments to these other areas, such as reducing your reimbursement rates to make room for the additional families that you'd serve with your eligibility level, for your eligibility levels. On the right-hand side, you can see in this example, you'd be increasing your reimbursement rate. So for example, if you wanted to provide an enhanced rate to providers, which I know a lot of states are doing right now, depending on your budget, you may need to consider decreasing your eligibility levels or in some way increasing your copay. So this is just really an example here for you all to think about how different factors can impact your budget. And at Nixia, we have actually been working on a budget calculator, which Michigan has been kind enough to pilot for us and we'll talk about in a little bit. But this budget calculator will look at basically the impact of eligibility levels, rates, and copays on a lead agency's bottom line budget. I'm going to walk through the different tabs of it now at a high level. If you are interested in getting individualized TA on this, you can reach out to us and we'll do a deeper dive demonstration into the calculator and also talk about how we could potentially customize it for your state. No lead agency in the country is exactly the same in terms of structure or budget, so what we're going to show you today is an example that can be customized, and we'll hear from Michigan on how you can customize it. This tool is for states and territories. For tribes, I want to mention that the National Center on Tribal Early Childhood Development has a simplified tool for tribes for projecting CCDF spending for direct services. If you're interested in that tool, please put in a request for technical assistance through your regional office on that. So for the first part of the budget tool, we have a budget summary tab, and this is basically a way for us to look at your current available CCDF funding and spending and calculate whether or not there is a surplus or deficit in your funding. It includes your current available funding, proposed budgetary changes related to reimbursement rates, eligibility levels, and copays, and then the available funding that's projected to be available with your budgetary changes. As we move through this, green cells are areas that must be entered manually. Black cells will auto-populate for you. So as I just mentioned, it does pull in totals from each worksheet that I'll go through on those three different levels. And then finally, there's a budget summary tab that calculates your total available CCDF funding when using this calculator. So the first worksheet that we have is a reimbursement rates worksheet, and this calculates the changes in cost due to changes in reimbursement rates. So for example, I mentioned earlier, an example would be if you wanted to pay enhanced rates, this is a worksheet that could help you project what your costs would be related to that. In the example here, we do use average annual expenditures for different types of care in our calculations. You can break this out more specifically. We've worked with a couple of states that have done this. In Michigan, we'll talk about this, where you can break it out so that instead of using average annual expenditures, you're using your actual rates and your number of children directly in your calculations. The reimbursement rate worksheet can be adjusted based on age groups. So for example, we use the infant, toddler, preschool, and school age categories that are reported in the state plan for this spreadsheet, but states, we recognize you do have different age groups, and we can adjust that and modify that in the calculator. There's also different types of care that can be built in the calculator. Right now we have center care and family child care because those are two of the most common, but we do recognize that some states might have 8 different types of care and want to build that in here. So that's another thing that you can do. And then you can break your reimbursement rates out into different categories. So if you want to make this a more specific tool for your state, you could build in quality rating systems. So that's what Michigan did, and we'll talk about. And then other types of care such as part-time care or summer care. The next is the eligibility level worksheet. This worksheet calculates how changes in eligibility levels impact your overall budget. So if you want to increase your eligibility levels, then you can calculate basically what the impact would be overall to your budget to handle those additional families. This specific sheet is customizable in different ways as well. As we mentioned before, you can change the age groups. You can also change the type of care to add additional types of care. You can increase your family size. You might have, every state has different family sizes. I believe Michigan went up to 10 in some areas in this calculator, so you can expand it to additional family sizes. And then we also can adjust it based on your state-specific SMI or FPL as well. And then the final spreadsheet that we have is the copay worksheet. Copays are, very different based on different states, but we can build in your copay structure here. It's customizable based on your state. So if you have a sliding scale fee, which is what is included in this example, we can build that in. Copay limits, copays as percentages of your income can be built in. And then again, your family and child size income ranges are adjustable. So if you want to take it out to 10 children in a family, you can do that. In this particular scenario, we look at the number of children and the number of families in a specific income range, and then we enter in a desired annual copay change to get to what your copay increase or decrease would be for each income range, and then it totals at the bottom to show what your increase or decrease is in your copay, and then the total change to your budget. So this one is adjustable, but it's something to think about. For example, if you're looking at, we've used it for a couple of, for a state and a territory on, they wanted to project out what it would be to waive their copays through the end of the year. So this is a worksheet that you could use to do that. So again, if you're interested in TA on this, please do reach out to Nixia. We are happy to help on that, and we will provide individualized TA on the tool. And then next we're going to hear from Michigan's lead agency. We have Joel Durr, who will be presenting. He's a budget analyst from Michigan State Budget Office. Bethany Kramer is here to answer questions. She is a fiscal analyst with the Michigan Department of Education. And then we also have Beth Glomsky, who is a finance specialist with the Michigan Department of Education. So the three of them together worked on this tool and helped pilot it. So with that, I'm going to turn it over to Joel.
Joel, I'm not able to hear you. Heather, can you please support Joel? Joel, this is Leanne. If you could please take a look at the host-only chat box. Heather would like you to type in your phone number.
Hi, can you hear me?
Yes, there you are.
So sorry about that. I don't know what happened. So anyway, as it was said, my name is Joel Durr. I'm with the State of Michigan State Budget Office. So we're just going to talk a little bit about our state and how our experience was customizing the calculator. So just to give you some background on our state, for the last quarter for our child care program, we served about 34,000 children. Of this, there was around 3,400 providers that were either center-based or home-based. We also had about 2,100 licensed exempt providers. As this compares to statewide, we had about 8,600 providers statewide who were either center or home-based providers. So about less than half are CCDF providers for us. And to give you a little bit of background on Michigan, back in the early 2000s, our 0 to 12 population started to decline, and that really accelerated during the during the Great Recession.
And getting custom stuff built, I get all that. We're just trying to see if there is some kind of...
During the Great Recession, we had a large amount of outmigration, which really affected our 0 to 12 population. So our child care caseload was decreasing dramatically. So to address this, we've been making investments constantly for about the last 5 years to kind of get our caseload up. So if I can get to the next slide. Okay. Can you still hear me? Perfect.
Yep, you sound good.
Okay. So when it comes to customizing the tool, when NICSIA reached out to the state of Michigan, MDE and the State Budget Office formed a small team of 3 fiscal staff who you already heard introduced. So we had Bethany Kramer at the Michigan Department of Education. She worked specifically on the child care program, so she gave programmatic financial expertise. We had Beth Glomsky, who worked on the department's budget, who gave department-level expertise, and then myself, who was more at a statewide level. So really, us 3 were the only ones who really dug deep into the calculator and worked on it to tweak it to our needs. Every once in a while, we did have to reach out to our Director of Child Care, Lisa Brewer-Waldraven, with minor questions such as a copay question. Can we do this with policy, yes or no? And she was great. She is fantastic to work with, a very bright person. And then the last group who worked with us was the House and Senate Fiscal Agency. So they are very involved with the child care program, so we wanted their buy-in, and they were excited for the tool too, and we briefed them along the way, even if they weren't involved in every single meeting. So that was nice to get that. When it comes to how long did it take to create, really we only had 3 meetings with Ann's team, and before each meeting with Ann's team, we would get together as our small fiscal staff, and we would do, here's a pre-meeting, what do we want to solve, how do we want to build the calculator, and then normally one member of the fiscal team would work half an hour to an hour and a half on customizing the tool before the meeting. So all in all, of my time, it was maybe 10 to 12 hours over a couple months, so it really was not a big lift at all. And I know for our Director of Child Care, it was less so. So when it came to how it was developed, the very first step was understanding the tool functions. So as Ann just walked you through it, that was kind of our first step. Here's the calculator, this is how it works. And then the second step after we understood the sheet was recognizing with our data limits and our state-specific policies, how did we want to build this? So our data warehouse and reporting is actually at another agency, Michigan Department of Health and Human Services. So we cannot always get customized reports as quickly as we would like. So with that, we tried to we tried to identify, here's all the reports we know we can get consistently, and how do we build a tool to effectively use that data to accomplish our goals. And then the very last part was recognizing who the audience will be. So the main audience is going to be MDE and State Budget Office, but also House and Fiscal staff because they're so involved. So we wanted to make sure we got their buy-in as well. So in the next couple slides, we'll just go through and we will talk about some screenshots. So of the tool that we just walked through, this was the one tab that Michigan added. It was called the 3.5 rates tab, but this is basically a screenshot. As you can see, this is for our center care. And we have an age breakout, infant, toddler, preschool, and school aged. And then we have our Great Start quality rating system. This is because for what your STAR quality rating is, you get a different hourly reimbursement rate. We wanted to get down to that level because that's normally how our budget investments are made. So the column C, that's our current rate. Column E is the current number of children in care. And as you go, you can see average paid current annual cost per child. Anything that's highlighted yellow are things that would be impacted by our investments. So proposed rates, we could hard code in proposed rates there, estimated number of children in care. You could either use census data to get this, or if you wanted an option of a quick number, you could say increasing 5% of federal poverty is roughly a 7% increase in the total eligible children. So we're just estimating 7% more cases. And then that 7% just multiplies out through all the age brackets and start rating. So there's kind of a, if you have the data, you can get a little more exact, and if not, here's an easy way to run it through. So yeah, that's kind of all that is. We threw on the 75th percentile, give us an idea too of where we were at according to that. So then the next tab is the same sheet, just slightly above, and that will be our summary sheet. So this is for every age range, specifically, how many children were served in each, annual cost, and then what would be the total cost of the rates and eligibility investments. So the good news with this sheet is it gave us a quick overview, and it also allowed us to pull data directly into the other tabs, the reimbursement rate and the eligibility worksheet that Ann just walked through. So we got to have our detail on our sheets, plus we got to have it feed into the calculator as it was built. So that was pretty nice. And then the final sheet I'll talk about is just the copay sheet. And I just wanted to touch on how little we had to change this one. So as I mentioned, we did add up to 10 families for our family size because that's how our copays and income ranges are done in Michigan policy. And then we made one small tweak when it comes to showing the copay as a biweekly amount as opposed to just an annual amount. And this was just a preference thing. So for the most part, we had very little tweaks to do on some of the tabs, and we just decided to add our own to get a little bit more detail on that. So when it comes to how this will be useful for us, one of the most important ways is, as you know, we have done a lot of investments in the recent years, and it seems like MDE does their own cost calculation. So does the State Budget Office, so does House Fiscal, and so does Senate Fiscal. And if we're different at all, then it's how are we different? Are we making a mistake? What assumptions did you make? And it can take a while to kind of slog through that to actually get to the useful information in the budget process. With this will be one tool that's used by all 4 agencies when it comes to our budget estimates. So it'll really streamline that process, and it'll help make that more simple for us. The second thing is it'll standardize through staff turnover. So I know working in government, some people become so important and they have such a knowledge and expertise, but then when they leave their position, all of that knowledge goes, including any spreadsheets that they have made. And I know in my position, I've had spreadsheets from old people or old colleagues that I have taken over for that I couldn't figure out, so I just started a new one. Now this, we're going to have 4 different agencies using the same one, so even if a couple staff leave, it'll keep that standardization, it'll keep that calculator running through the years. So it'll be easy to compare year to year. And then also, it's just a simplification of budget estimates while being more accurate. So some of the sheets that we have used in the past to kind of estimate, here's an hourly rate investment, can get sloggy and complicated depending on the data source that they were using. This is just a clean cut, easy to read version, so I think it'll be great. And when it comes to COVID-19 data, we were asked to touch on this a bit. So is the calculator currently built so that Michigan can use it to estimate COVID-19 costs and implement COVID-19 data in it? And I think that it is. All the information, all the data is there. If we want to even see what the change is from COVID-19 versus pre-COVID-19, you can just create a copy of the entire calculator, input COVID-19 data in that, April to June, say, and then look at the few months before COVID just to say, what is the COVID-specific impact on my state, even if I haven't made any investments whatsoever? So I think if we wanted to use it for that purpose, it's definitely built for that. And then the very final piece is decision makers. So I like how it has a nice clean summary sheet, so any legislators can look at it, or our state budget director can look at it one page and see, this is the investments, these are how they're going to be, and this is where we're going to be at the end for our balance. So we thought that was very useful as well. So I think that's all of our presentation. So if there is any question that we can help address, just let us know.
Yes, thank you so much, Joel. We really appreciate it. And if you have questions on the budget calculator itself, please feel free to enter it on the left-hand side here in the chat pod. And then if you have questions for Michigan, now's the time to ask them, and you can put it on the right-hand side there as well. Lindsay Hill asked whether or not there is a link to this calculator, or do they have to request it via email? And yes, please do request it via email to Nixia, or you can reach out to your regional office and they can put in a request with us as well. So Joel, there's a question for you here. How long did it take to build the budget calculator? Which I think you touched on a little bit, but.
Yeah, no, that's a good question. So for me personally, I think we started the process in around April, and we had kind of like a meeting a month. And each month it was maybe 3 hours of work, but that was it. Just a little bit of pre-planning, a little bit of work to customize where we needed to, and then we'd meet up to discuss how it was going. So yeah, overall, 10 to 12 hours.
Okay, great. I'll give it another minute. If there's anybody else who wants to ask a question of Michigan or Nixia, please feel free to do so. Okay, thank you again, Joel. And with that, I'm going to turn it over to Leanne Bryan to help close us out.
Thank you, Anne. We're just going to take one last minute here to see if there are any other questions for our Nixia presenters or for Joel and the Michigan team. Or if there were any questions that we didn't get to earlier, we do have about 14 minutes to go. We could potentially address those now. Not seeing anything come up in the chat box, but I will pause just a couple more minutes here. See if there are any last-minute questions. Give you all a moment to think about it. Think about the tool that was shared. I'm going to go ahead and move to what's coming next. However, if you have questions, feel free to put them in the chat box. So for those that stuck with us over this past year, this is the last webinar of the current fiscal year, 2020, but we are starting the planning for FY 2021. So our next webinar will very likely be in December, and we are looking for your input on program integrity and fiscal accountability topics that you all may want to dig a little bit more into. So if you do have suggestions or topics of interest, please feel free to let us know via the evaluation. And I'm hesitant to move to the evaluation just yet, but I don't see any other questions coming in. Oh, it looks like Jennifer's typing. So I'm going to give Jennifer a second before we change the layout on you.
So Jennifer, the question is there a way to mandate that the program that has TANF funds to shift up to 30% of TANF funds to the lead CCDF agency? I'm not quite sure the answer to that. At a federal level, that's probably more of a policy question for OCC. So I'm just going to check in with OCC really quick. And they said to please talk to your regional office about that as a potential possibility.
All right, I'm not seeing any other questions come in the chat box. I'm going to go ahead and move us to the evaluation layout. We do appreciate everyone's participation today. We do apologize for the audio issues. Unfortunately, it didn't seem like there was a whole lot that we could do to remedy that, but we did have Meeting One support on the line and did their best to try to help with the audio challenges that we were experiencing. But we do appreciate your feedback. We value your opinion. We want to ensure that these webinars continue to meet your CCDF program integrity and fiscal accountability needs. So if you could please take about 3 minutes to complete this evaluation, we would appreciate it. And we will use your comments and feedback to improve the webinars and to consider topics for the webinar series in 2021. Thank you all for joining us. Anne and team, if there are any other closing remarks, otherwise we will leave the webinar here open for a few minutes so that you all can complete the evaluation. Thanks again for joining us. Hope you have a great afternoon.